Today we are talking about blood pressure in pregnancy, a condition that we medically term as preeclampsia. I will first begin by explaining what preeclampsia is, the causes, complications, the risk factors that are associated with it, the signs and symptoms that when you see them, you will maybe sense that you're suffering from this preeclampsia, and finally, we'll talk about the treatment. So what I have to say about preeclampsia is that preeclampsia is a situation whereby the blood pressure are elevated and there is a damage of other organs. This preeclampsia begins from the 20th week of pregnancy. So if you are not up to 20 weeks of pregnancy, then you are not a candidate of this preeclampsia condition. When we talk of the causes of preeclampsia, the main cause of this condition is not known, but it is believed that it begins from the placenta. When during pregnancy, the placenta develops some blood vessels. So these blood vessels are supposed to develop normally so that they will be able to transport blood. So if it happens that these placenta blood vessels fails to form properly, then they limit the blood flow, hence leading to high blood pressure. When we talk of the signs and symptoms that we're supposed to expect, we have number one, it's whereby you have severe sudden headache. So in this situation, some people will present with headaches that has been so sudden and it's very severe. So that is one sign of preeclampsia. We have the second sign, it's whereby you experience some pain on the right upper quadrant. What we mean on the right upper quadrant, it's whereby you experience pain on your right side or just below the ribs. So if you have that kind of a pain, also that one is also another sign of high blood pressure while you're pregnant. Another sign is whereby you may have nausea and vomiting. But nausea and vomiting, these are very common symptoms when a person is pregnant. So in most cases, we say if it happens you have this nausea, you have issues with vomiting, and at the same time you have some severe headache, that can also be associated with a pain on the right upper quadrant or just below your ribs, then that one is also an alarming sign of blood pressure. We also have another shortness of breath. So in most cases, people present with the shortness of breath or inability to breathe. This one is caused by an accumulation of fluid in the lungs, something that we refer to as the pulmonary edema. Another sign, we have sudden weight gain, and this sudden weight gain simply results from the accumulation of fluid in the body. We also have another sign whereby you experience the changes in vision. In this situation, people may present with a temporary loss of vision. They may present with blurred vision or something that we refer to as photophobia, or whereby a person is so much sensitive into light. Another one, it's whereby we have whereby we have issues with the inflammation or swelling. People may present with the swelling on the face, swelling on the hands, or even swelling on the feet. So if it happens you have this issue of severe headache, you have issues with the blood vision, you are too sensitive to light, associated with some swelling of the hands, the face, or even the legs or the lower limbs. You also present with issues with pain on the right upper quadrant. You are supposed to be very careful because those are the signs and symptoms of preeclampsia. Another very common sign of preeclampsia is whereby you present with a high blood pressure that is measuring 140 systolic and 90 diastolic. Or in other words, in simple language, anytime when you check your blood pressure and it measures 140/90, more than one reading in a span of less than 4 hours. So this means that if you take your blood pressure now then it reads 140 all over 90, and again when you test it again after 4 hours and it still remains to read 140 all over 90 or above that, then that one is not normal, and it's also a similar sign of you are having preeclampsia. So those are the most signs and symptoms that you are most likely to get. So some people may fail to experience weight gain, some people may fail to have issues with the nausea and vomiting, but the most common signs that you are supposed to expect, number one, we said are the severe headache. Number two, it's one by you experience vision disturbance, or in other ones you are having issues with the blind vision, you are too sensitive to light, or even whereby you sometimes experience some temporary vision loss, or in other ones where you see like you are experiencing some blackout, and also having pain on your right upper quadrant, and then the very main distinguishing feature here, it's whereby you swell on your face, you swell on your hands, and mostly on the outer side of the hand, and also on your feet. So if you have that swelling associated with these other signs and symptoms, then you need to be checked for your blood pressure. When we talk about the risk that can predispose one into getting this blood pressure, number one, it's whereby if you have a previous history of preeclampsia. So what I mean, it's one by if in your previous pregnancy you experienced an issue of high blood pressure, that one is also a predisposing factor. Another predisposing factor, it's one by if you are primigravida, or in other ones, if it is your very first pregnancy. During your first pregnancy, more likely to develop high blood pressure, or you are at a higher risk of developing high blood pressure. Another risky factor is issues with the neopaternity, or in other ones, if you are getting pregnant with different fathers, like your first pregnancy you got pregnant with a different man, another pregnancy and different man, another pregnancy and different man, that also predisposes you into suffering from preeclampsia. Another risky factor is the age. In most cases, when we talk about age, this is whereby you get pregnant while you are above 40. Also, that one predisposes you into getting blood pressure during your pregnancy period. Another risky factor, and which is very common, it's issues with the overweight or being obese. So these are obesity. In most cases, it is associated with high blood pressure even when you are not pregnant. So if it happens you are pregnant and you are obese, then you are also at a higher risk of developing this blood pressure. Another risky factor is one by you have multiple pregnancy. What we mean by multiple pregnancy, it's one by you are pregnant over twins or even the triplets. So if you are carrying a pregnancy that has more than one fetus, then you are also likely to suffer from blood pressure. And then of course we have other conditions or other diseases, like maybe if you are already known an hypertensive patient, or you have issues with diabetes, you have issues with the kidney failure, and any other problem, then again you are most likely at a higher risk of suffering from blood pressure. Another very common is whereby you have the pregnancy intervals. Pregnancy intervals, if you get your pregnancy too early in less than 2 years, or you get pregnant after 10 years, you are also again at a higher risk of suffering from blood pressure. Now we are done on the risky factors, and we now want to check on the complications, or what can happen if this blood pressure has not been addressed for so long. So if you have been having this problem of blood pressure while you are pregnant and it has not been addressed, it has the possible complications. Number one, it's where we have hypoxia. Remember we said one cause of it it's the failure of the blood vessel in the placenta to form normally. So if these blood vessels in the placenta are abnormal, number one, what will happen? There will be not enough supply of oxygen into the fetus. So number one complication is low oxygen supply into the fetus. If there is low oxygen supply into the fetus, at the same time there will be no adequate nutrient transported to the fetus, and that will result to premature birth. It may result to low birth weight. Another one is whereby we have a placenta abruption. Placenta abruption is whereby the placenta detaches itself from the walls of the uterus. So if you have been having these high blood pressure issues and it has not been controlled, then you are at a higher risk of having the placenta abruption, or a situation whereby the placenta detaches itself from the uterus. Another complication is whereby you have issues with the eclampsia. So we're saying that preeclampsia, this is just like a stage 1 of the blood pressure, and now we have the main eclampsia. Remember, we said preeclampsia, we said this is a situation whereby the blood pressure is increased and there is risk of other damage of the body organs, maybe like the kidneys. But now when this preeclampsia matures into become an eclampsia, you are number one, your blood pressure is high, your body organs are damaged, and at the same time the pregnant mother might have issues with the convulsions, or what we term to as seizures, or in other ones fainting. All right, so you can, if this preeclampsia has not been managed, it results to eclampsia that now gets an addition of a problem whereby you will have issues with convulsions or fainting. There will be a damage of your organs, and at the same time the blood pressure will be high, and this situation, it's very fatal both to the fetus, and it can even easily kill the mother. Another complication, it's whereby we have a condition that we refer to as HELP. This HELP, it's whereby you have, number one, this H, number one, stand for hemolysis, or the destruction of the red blood cells. Then we have elevated liver enzymes, and also we have problems with the low platelets. So if this condition has not been managed, number one, it will result to a destruction of the red blood cells. So these red blood cells, after the red blood cells have been demolished, then it means there will be issues with the oxygen supply and the amount of blood that may result to anemia. Then we have issues with the elevated liver enzymes, and we have the low platelet counts in the body that may result to issues with the bleeding and what. All right, so those are the most common complications that are there. When we talk of the diagnosis, we can diagnose this one, number one, via an ultrasound. We can diagnose this via blood test, and we can diagnose it via urine analysis. Number one, what we check in urine most of the time when we suspect a mother might be suffering from preeclampsia, what we check in urine, we check for something that we refer to as proteins. So if you have preeclampsia, the very first thing that we'll note in urine is a protein, as something that we refer to as proteinuria. So if it happens you have proteins in your urine, then we are then that one is suggestive of that you have preeclampsia. But again, not every situation when you have proteins in urine indicates that you have preeclampsia, because in some other time you might have this protein in urine, but your blood pressure, it's okay, and there is no any other symptom. But if it happens, you see it in most cases, and you have the symptoms that you have just talked about, then it means that you might be having preeclampsia. Another thing that we check, we also we need to check for your blood. In blood, most of the time we concentrate so much on the platelet to see whether the platelets are reduced. We also check on the red blood cells to check whether they have been demolished, than just something that we have talked about, the hemolysis. We can also check on the urea and the creatinine, or in other ones we can check for the kidney function test to realize, to check whether the kidney has been damaged as a result of this. From there again, those are the most common test that we run when maybe we suspect you might be having this preeclampsia. So those are the most common tests that we run. Now, when after now talking of the diagnosis, automatically the next thing is how can we treat? I will say that the only best cure of this preeclampsia, it's delivery. So if it happens your pregnancy is young and you cannot deliver, so because in most cases this, we remember we saying that it presents from the 20th week. So if you are 20 weeks pregnant, in most cases we cannot just advise you to deliver. So in this scenario, there are some medications that we give for at least so that you can be able to sustain this pregnancy. Number one, we give the antihypertensive medication. In hypertensive medication, we give the drugs to lower your blood pressure, drugs like the methyl dopa. If again you have issues with the convulsions, or to prevent convulsions from occurring, we give you anticonvulsant medications, and in this case we mostly give the magnesium sulfate. So we give the magnesium sulfate, and that one plays a part whereby 80% convulsions from taking place. If you have issues, if you have these complications that we are talked about, the help whereby we have hemolysis or the levate and liver enzymes and issues with the low platelet, then we give you the corticosteroid medication. So number one, this corticosteroid medication plays two roles. Number one, it helps in this condition, the hemolysis, and the low platelet and the levate and liver enzymes. It helps in this. And the second main thing where the reason why we give corticosteroid, this corticosteroid helps in rapid maturity of the fetal lungs. So in because what we try to do when we prescribe this when we prescribe these corticosteroids, we are trying to boost the rapid maturity of the fetal lungs, so that when this child is born, even before weeks, at least the child will not be having issues with the lungs. So that corticosteroids plays a part in making that the lungs of your fetus has developed rapidly, and in most cases they just mature within 48 hours. So that is one main thing why we give this corticosteroid. And of course we also advise on bed rest, and in most cases if your blood pressure is so severe, you get hospitalized so that your blood pressure will be managed closely. So but in most cases the management that we give are only two, whereby number one, we give them blood pressure medications, and we also give the anticonvulsant medication to prevent you from having issues with the convulsions. Again, after now we have given you this medication, then we put you on a regular clinic visit, so that we'll keep on checking your blood pressure, and we'll keep on checking your overall health and the overall health of the child. Remember, we also advise on ultrasound, and this ultrasound helps us in checking the weight of the baby. Because remember, we said one of the complications is whereby there will be cut off blood flow and cut off oxygen and also nutrient supply to the fetus, because these blood vessels has not developed normally. So if there is that cut off of nutrient, then it means there will be low nutrient supply that may result into low birth weight. So we also check on the using the ultrasound, so that we can see the overall state of the child. So if it happens you have issues with the blood pressure, or if it happens you have some of the symptoms that we have just talked about here, I would advise you to visit to the hospital, let your blood pressure be checked, so that we can you can be diagnosed of whether you have this problem with blood pressure in your pregnancy journey. If this is the very first time when you are coming across this video, I kindly request you that you may subscribe. If you have a question, ask it into the comment section and we will answer you. Kindly remember to like, subscribe, and share the link with your friends, and you can also invite more friends.